I was diagnosed stage 2B in January 2007, and I was diagnosed stage 4 with tumors in my liver and my pancreas in January 2011, 11 weeks after our son was born. At the time that I was diagnosed stage 4, I was in complete denial. So when we went for my screening appointment with my research fellow, we took with us a picture of me and our, at the time, 11-week-old baby, and we said, I have no other choice but to survive this.
In 2010, it was already 4th stage, and it didn't look like much hope was left for me out in Colorado.
Melanoma will do one thing, it'll sure fight off boredom, and then in a long week, we find out it's metastatic, that it's inoperable, it's in 4 of my 5 lobes of my lungs.
My interest in melanoma started about 18 months ago when my son Lee was diagnosed with stage 4 melanoma that had metastasized to his brain. He had no symptoms. It was caught by a doctor, fortunately. He had brain surgery and the tumors were removed from his brain, and he's been on a clinical trial ever since.
I was diagnosed with stage 4 melanoma in August of 2012. As a father of 2 young children at the time, we weren't looking for many more months. We wanted the best chance of getting a durable response. I went through 4 doctors before I decided on my first treatment.
I had stage 3C melanoma on my nose. When I had a CAT scan, sure enough, they found something on my lungs. Not being one that could just be patient and sit back, I went back to Dr. Scharfman at Hopkins. I'm like, is there anything you can suggest? I qualified for their trial. I started in February of last year, went every 2 weeks for 24 weeks, and I've had not one side effect. I feel great. I've been running. Nothing in my life has changed. I was thinking it wasn't working. I'm still waiting for the weight loss. I'm like, okay.
We knew that joining a clinical trial at the time was going to be my best option for long-term survival. We were in my room and we were putting up pictures of our baby so that we could see him from the bed, and I would remember, no matter how bad the side effects got, that this is what we were fighting for.
For anyone starting out on this journey, the first thing is stay strong. Don't settle for what your first diagnosis is. There are a lot of clinical trials out there. There are breakthroughs happening at a very rapid pace.
Here's your chance, here's your hope, is what you're saying.
Find out what is available for you and understand that clinical trials are a viable treatment option for people with cancer. I started my treatment with an unwavering confidence in my doctor and my medical team that carried through until now when I have no evidence of disease. We saw Dr. Rosenberg in clinic and he said to us, Jamie, it's a miracle. I am so happy for you. And we celebrated, but it was not a miracle. It was the outcome of a lifetime commitment and dedication to finding ever more effective treatments for melanoma that saved my life.
I get to play with my children, I get to bring them to Disney World, and I certainly don't feel like the typical cancer patient.
With all the research that's being done, hopefully it will help provide a cure for Lee and many, many other patients.